Welcome, Dr. Christian. I'm so happy to have you on my podcast.
Oh my gosh, I'm so excited to be here.
Yeah, I know. I'm really excited. We were just discussing all the things that we want to get into. So you guys are in for a treat. So let's start off by having you explain who you are and what you do, a little bit about your background.
Should we not at all say how we met?
Oh, okay. Yes.
Yeah, I think that'd be cool because I think we've seen each other's journeys
Mhm.
and but we met maybe 7 years ago. That was I think
Was
2013 or 14 at a music festival, of course. So
yeah.
I met Miss Shantih in her like full like in her elements, and I think you kind of met me there too.
Well, we
And
met on the internet first. You were like the stranger that I trusted to like get into a carpool
uh-huh.
with.
And I swung by and picked you up and another person, and we drove to this music festival,
Mhm.
and yeah, and then 7 years later, I'm sure you've gone through all these different changes too in life, and in that time, I finished up the program that I was doing at that time was a naturopathic medical school. A program in Tempe in Phoenix, near Phoenix, Arizona. And so since then, I've completed the program and I've been working as a licensed naturopathic doctor ever since. So, and I guess now we're segueing into what I do and why I'm here on your podcast. But so my background since graduating, my background over the last 5 years has been in hormone replacement therapy, mostly doing men's health and testosterone replacement therapy. I also work with helping to identify and to correct nutritional deficiencies. And an easy example of that would be like vitamin D. People don't always check for it, but I know it's super important. So I always make sure to check for it and get people back to optimal levels. I do a lot of work with vitamin injectables too. So if you've heard of like B12 shots or IV bags of vitamins where that's administered in a drip through the vein, and knowing what vitamins and minerals to put in them to help patients when they come in for whatever reason. So a lot of hormone therapy, a lot of vitamin therapy work, and I also do a lot of chronic disease prevention and management for patients too. So we're talking people who have a history of high blood pressure or diabetes, and maybe their primary care doctors are only ever giving them pharmaceutical intervention, and then those kind of just pile up on each other, right? So I like to come in and give them other options, and I don't take them off their medications. But I do kind of give them hope that there are other things that they can be doing to eventually be able to come off some of their medications. So this is all part of that chronic disease, and prevention and management part of what I do.
Mm.
So that's everything. That's like kind of that. I think that's a three-parter. But as a naturopathic doctor, a lot of what we do is helping people with. They often say it's a kind of like uh, they kind of beat this to the ground. The idea of working with a patient at the root cause of their issues, what are the fundamental causes for their disease. And as naturopathic doctors, we know that that's always going to come down to your diet and lifestyle.
Mm.
So we start there and get to know what a person is, what their habits are with around their dieting, and also around just lifestyle things like
Mhm.
stress and exercise, if they're getting it, sleep, how they're pooping. All of these
Mhm.
things are important for us to
Poop
know.
is actually very important, which
To
you don't, which we all like are like, oh, wait, you don't want to talk about poop, but actually it tells you a lot about your
Yeah.
health.
As
Yeah.
naturopathic doctors, you're able to spend more time with your patient to kind of get all of this basic information down that you don't get to always talk about with your other doctor, because those visits are a lot shorter.
Hmm.
And that's just the way it's set up. That's just the way
Hmm.
that type of healthcare model is set up. And if they want to talk to you about clinical nutrition information, they'll likely send you to a nutritionist or somebody else. And so as a naturopathic doctor, we're trained, a big part of our training is clinical nutrition. So whereas another doctor, say an MD or DO, maybe gets a few courses, ours is a little bit more extensive. And so again, just more information about naturopathic doctors, we have certain set of principles that guide what we do that are all kind of come from our philosophy, or the philosophy behind what we do as naturopathic doctors. And so one of those, I mentioned these a lot on my Instagram account. Yeah, I like to make sure that I kind of harp on what we do as NDs. One of them is the healing power of nature. And another one is treatment as prevention, just making sure you're always thinking about preventing disease in the first place. Doctor as teacher. So as a doctor, you're the one that's supposed to educate your patient about their disease process and what they can do for it. And really kind of, that's a big counseling component to what we do too, because we're able to help the patient. I always call it facilitating patient self-empowerment. That's what I like to say, because when you're giving them the information that they need, they're now feeling like they can tackle whatever health issue that they're dealing with. So they've empowered themselves. There's a better chance for them to make the changes that they need to make if they're given the information, so that to make it happen. So then there's also there's three other ones that I can't think of off the top of my head now, but there's these principles that guide what we do that make our approach to healthcare just naturopathic, which I was going to say, the different than the conventional model, but it makes it very unique to naturopathic medicine, the way that we approach when we see a patient.
And sorry, are you still in San Francisco?
No, so I'm down in Santa Monica now.
Oh, okay.
Yeah, so my office is in Santa Monica, and I am living in West Hollywood.
Oh, no way. I didn't know that.
Yeah.
Right on. Okay. Well, that is good for anybody that wants to come and see you that's down there. Or do you still make house calls, or is that part of it as well?
So no, so during lockdown, I think a lot of people did go virtual mostly.
Okay.
I, during the last year, was working for an urgent care in Phoenix, Arizona. That's where I was up until about December of last year, and our clinic functioned as an urgent care. So we would see patients coming in for things that were acute. And then a lot of times though, these patients didn't have a primary care doctor. So if they came to us for knee pain and I checked their blood sugar and it was really high, or their blood pressure and it was really high, they would convert into more chronic care, primary care patients as well. So it functioned as urgent care, but also I did a lot of primary care there. And we stayed open because people needed to see us. And when other clinics were closing because maybe they were just nervous about staying open during that time, we didn't skip a beat. We got busier. So this was all in person, never once went virtual over the whole, the events of the last year. I like to call it the events of the last year.
I know, because we're so sick of hearing those certain words.
Yeah, it's super triggering, but I want to talk about what the last year has been like for me without having to, talk about what went down. But we'll say, because it's triggering. So and I feel like even when you don't say it and just talking about it. So we stayed open. I haven't gone virtual. I'll do follow-ups with patients over the phone if I need to. So yeah, my office here is all in person. I see people for mostly hormone replacement therapy and vitamin therapies. Yeah.
Okay. Well, I want to jump into testosterone replacement therapy and the difference between juicing or steroids, because I know there's a lot of stigma around that. And I know there's also a lot of different reasons for doing one or the other, but maybe you could explain the difference.
So the main difference with testosterone replacement therapy, you are it's going to be supervised by a doctor. So as a doctor who prescribes what we call TRT, it's typically also 2 to 3 medications total. So it's the testosterone as an injectable most of the time. And so there are different ester compounds that make the testosterone different between, so that there's the testosterone cypionate, for example, the testosterone propionate, and others. But so either a variation of that testosterone is one of the medications. The second one is HCG, which is human chorionic gonadotropin. That's also done as an injection most of the time. And then the third thing is some type of estrogen blocker. So you would use anastrozole is the big one. So what this does is it blocks the conversion of testosterone to estrogen.
So that's the one that stops you from growing boobs as a man, right?
Exactly, because it keeps your estrogen under control.
Oh, okay.
So if you're talking about TRT, it's usually those medications. And so anything, and if you're talking about TRT, it's in response to somebody having already checked their levels and they see that their testosterone levels are in a range that I like to say less than optimal. And I say that because you might be curious as to where your testosterone levels are because you've got all the symptoms. Maybe you saw a list of all the symptoms of low testosterone and you're saying, yes, that's me, low energy, low libido. I put a lot of effort in at the gym and I don't get any muscle growth and I can't get rid of this body, the belly fat, and there's brain fog and I'm having trouble sleeping and everything's just falling apart. And then they check their testosterone levels and the doctor tells them that they're normal. And again, this is a conventional doctor, likely doesn't do testosterone replacement therapy anyway. Maybe it's someone's general their primary care doctor. And so they'll get checked and because they're curious about their testosterone, and it'll say that it's normal, but it's in the low end of range. So if you think about just total testosterone, the range is anywhere between, I've seen it as low as 250 to like 900 is the range that a lab will use, or maybe 300 to 1,000 is another one. And if somebody falls in like that 300 to 400 range because they were curious to know their levels, and the doctor says, you're at 350, your levels are normal, they're not going to do anything for you most of the time, if not all of the time. But we know that just because somebody falls within range doesn't mean that it's normal for them. Like it's not normal. So anything less than optimal for me is there's potentially you could benefit from testosterone therapy. Okay. And TRT. And again, as long as you are making sure that you're using those 3 medications, you're going to be able to control for anything that could potentially go wrong. And so when you're thinking about anything that's not TRT, then there's a lot less supervision, because I wouldn't prescribe some of the things that are out there, because I just understand the human body and the science. And they know that they're pushing it too, because they don't, it's not done continuously forever. They have to stop because they're putting kind of certain things are being compromised. So, and it can be a variety of different combinations of substances that are being used that are not, again, that usual triad that you would consider as part of TRT. So it's hard to control for that. So if I see a patient who's been on anything other than just TRT, it's hard to know what exactly they need to do next, because other than just stop completely or find a way to wean off of it so that they can do it in a way that's more that's easier to supervise and to take away a lot of the guesswork, so that you're having the same benefits without really pushing your body to the limit. So what can happen with everything other than TRT is the main thing I see is that when you take something like testosterone or some of the synthetic forms, it can increase your production of red blood cells. And so your blood will become thicker over time. And so what I oftentimes see with patients who have come to me to do the testosterone replacement therapy, who have done other stuff before, is that their blood is way too thick for me to even want to take them on as patients, because now you're just assuming the responsibility of a lot of the choices that they made prior to you. So that's, and a lot of the times that's when they come to me and I do the testing to see where their levels are at. That's probably one of the few times they ever tested themselves to see what exactly their hormone profile looks like. And so, and not only that, but also what their blood health looks like. So somebody, what we typically check on labs for that when we're thinking about starting somebody on TRT is we want to look at their hemoglobin and their red blood cells and hematocrit. So hematocrit tells us directly how thick the blood is in that patient. So that's the main thing to look out for.
So you had said about testosterone and then synthetic. So is there a difference between like when someone is getting testosterone replacement therapy, is there like real testosterone that's taken from somewhere else and then synthetic, or just
so when you're doing testosterone in one of the ester forms, so testosterone cypionate, for example, it's the most bioidentical form of the same molecule that your body, the same compound that your body is able to make naturally.
Okay.
So then some would consider it bioidenticals. But the testosterone, when it's attached to that ester compound, is then testosterone cypionate, for example. When you inject it or when you put it into your body, in order for it to be used, that ester compound gets cut off of it, and then it's turned, and then you're left with what your body's makes naturally, which is the testosterone. And so all other forms are just going to be not as simplified as that, not as like as it won't be as close to that same compound.
Okay. Yeah. Interesting. All right. And then like I think you had mentioned earlier, like around like, because I think this is another aspect of, I would say some of the confusion around testosterone replacement therapy and steroids. The difference between the two is like also it being like age appropriate as well, because you were saying that there's generally certain ages that you would be like, obviously there's exceptions, but you were saying there's like more like age range appropriate.
Yeah. So, and I guess I'll go back just a step and talk about TRT. So right now, testosterone replacement therapy, I approach it in a unique way as well as a naturopathic doctor. So there are other doctors that will prescribe and supervise TRT for their patients. But as a naturopathic doctor, my approach is always going to be a lot more comprehensive, in that when someone comes to me and they're curious about their testosterone levels, I'm also going to look at the rest of their, I'm going to look at other things as well. It's never just cut and dry testosterone. What's your testosterone doing? What's your estrogen doing? What's your blood health doing? I like to look at somebody's adrenal health, thyroid health, their potentially any vitamin deficiencies. And also then looking at diet and lifestyle. So there are so many components to the full picture. So when you mentioned somebody who was maybe younger, thinking about being on testosterone therapy, what would be like what most people would think is that they're too young, that this should be like the prime of your life. You're in your 20s, 30s. Your testosterone should be like optimal already naturally. There's no reason why somebody that young would need to be on testosterone therapy. But there's some people who I've seen where I've tested their levels in their late 20s, early 30s, and their testosterone is low. It's not just low within the range, but it's actually deficient. And that's because there's an adrenal component that's super important that can be a big reason why they're struggling with their testosterone. So after the age of 30, men start to lose testosterone slowly. They say it's like 1% or something like around 1% of a drop of testosterone every year after the age of 30. And so that's normal. We're all going to experience that. But for people who also have a lot of stress in life, and maybe this is the person who's working 40 to 60 hours a week, who also is not eating healthy, who is not exercising as much as they need to be, who also, because they need to be at work, they have so many, they work so much that in a week that they have to also like maybe drink a lot of caffeine, or they're not sleeping well. So all of these things could eventually lead to an adrenal health issue. So your adrenals are responsible for giving you the cortisol, the hormone cortisol, your stress hormone. And so if your adrenals aren't giving you cortisol in a way that's efficient, then it's going to throw off your other hormones as well. So your testosterone can eventually start to take a hit from a poor adrenal health issue as well.
Okay, then that would be a good place to talk about diet and lifestyle and how that affects your adrenals and your hormones, because I often think about hormones as like, it's like a domino effect when one starts going out, but that would probably be like for you, the area where you're like able to figure out, well, where's the first chip falling? And then kind of going from there.
Yeah. So I definitely, it's the adrenals that go first. So for a lot of us, and that's because in our 20s and 30s, we are now it's not uncommon to have these 40 to 60 hour work weeks where work is taking up the most of your time, and you are also maybe not prioritizing eating healthy, or getting in some mindful movement and exercise. So then your adrenal health starts to suffer too, because then you're not sleeping. Like I said, you're not sleeping as much as you need to be. You're not recovering. You're drinking too much caffeine. So you're stressing your adrenal glands, and that's going to start throwing things off. So the way that the adrenals work is that there's the hypothalamus that tells your pituitary gland, that tells your adrenal glands to release cortisol. And so that needs to happen in a way that's efficient. So when we wake up in the morning, we all have cortisol levels that are at a certain amount. It has to be high enough so that when we wake up, we're awake and we're alert and we can take on the day. So as the day progresses, though, that cortisol level starts to drop, and it should come down kind of like a slide. Okay, so it starts off kind of high, and then it drops down lower towards the end of the day, because you want it to be low at night so that you're able to go to sleep. And so for certain people, though, because there's a lot of stress and because they're not sleeping well, because there's a lot of caffeine and they're working a ton, you start to stress out your adrenal glands, and now that cortisol production is not that nice curve that you're supposed to see. Now it's just wonky. Maybe it starts off high and then it drops down low. Maybe at like 2 p.m. it's gone down a little too low. And so again, less awake, less alert. This might be that midday drop in energy. And then by the time you're ready for bed, that cortisol might just bump up again. And this is why at night you might not be able to go to sleep when you want, because now you're dealing with cortisol levels that are too high. So this all comes down to then diet, lifestyle, a lot of stress in life is now making that HPA axis, we call it, that communication between the hypothalamus and your adrenal glands and how they release hormone is just off, and how they release the cortisol. So now, like I said, your cortisol should be coming down like this. And now with that adrenal fatigue, or the adrenals just being a little bit inefficient, your cortisol is going to be going up and down. And then you can get to the point where your cortisol is now just it's not even starting off high, it's just low most of the day, you know, because that's now you've caused enough stress to the adrenals that your cortisol levels are chronically low. And so if somebody reaches that point where the cortisol is just not at all working in your favor, when you're waking up tired and you're going to sleep tired, whereas before maybe you're waking up awake and alert, and at the end of the day you're tired as you're supposed to be. Now you're just kind of flatlined and you're tired most of the time. Like, of course that's going to affect your other hormones. Of course that's going to affect your sex hormones, your thyroid. It'll also affect a lot of things that so with your physical health. So when you have low cortisol, you're going to see it manifest in ways that you wouldn't think of. So cortisol is needed for proper for the way that with the way that we control blood sugar, for the way that we control our heart rate and blood pressure. Cortisol is necessary in healthy amounts. It's also necessary for your immune system and for inflammation, to combat inflammation. So all of these things are going to be influenced by cortisol. So when you're chronically low, it's a big issue for those reasons, but also because I haven't met a low testosterone patient who was in their late 20s or in their early 30s who wasn't already adrenally taxed. So, right. And so there's always that diet, lifestyle, stress component to those types of patients, to those young patients who are dealing with low normal, again, less than optimal levels of testosterone.
Well, and that's so interesting because I think like also it's interesting because self-care is something that most women seem to be a lot more used to, but for a lot of young men especially, there's like such a drive to go and just like, you know, train at the gym day in, day out. Like there's also a little bit of a expectation in our culture to like, you know, be ambitious, be a go-getter, go, but like, you know, that imbalance of basically burning the candle at both ends for such a long time and not taking a pause to rest, relax, and, you know, take care of yourself. It's like at that point, I wonder if it was more common knowledge that self-care is actually important for your testosterone, which is very important for like all of these other aspects of your life. I wonder if then it would be like a little bit easier for the fellas to be like, oh, okay. maybe I do need a bubble bath. Just kidding. I'm also curious, can you hear the lawnmower outside? Of course, when we sit down to do a podcast, they start mowing the lawn in my strata. No?
No.
Okay. You know, I'm curious, as you were mentioning, like, what about screens? Because everybody's on their phones all the time late at night. How does that affect this delicate ecosystem you're talking about?
Yeah, well, I mean, it's going to affect your sleep. So again, if you're not sleeping and you're getting that good quality sleep, then you're going to not feel rested the next day. And if you're not recovering appropriately when you should be, which is when you're sleeping, then you're going to be, again, taxing the adrenals. And so many things are going to affect your adrenal health. So that's one thing, is sleep, right? And so anytime you can do things to improve sleep hygiene is going to be better for your adrenals, which are then going to be better for your hormone balance. So your sex hormone balance. So, and testosterone. So that's that connection there. But like you mentioned, self-care is, I think, back to just stress management is the what you're getting mostly out of that. And so stress management, a huge component with trying to if you're trying to balance or optimize your testosterone health. And so oftentimes what I tell patients is that the mental health part of your overall health is super important. So when I talk to patients about their health, I call it their whole body health. So we're thinking about the physical health, their mental health, emotional health, and their spiritual health. Like you can't just treat the physical and then think that they're going to get the health outcomes that they want if you haven't addressed the other parts. And so when I talk to patients about diet and exercise and lifestyle, I almost don't even want to use the word diet a lot of the times, because for people that's kind of like not, it's not something that is pleasant to talk about, because usually when you think about dieting, it's about restrictions and things you shouldn't be doing, as opposed to like what you could be doing for around healthy eating and mindful eating, and for your health, just your health, and just to have like really good heart health or really good you know blood sugar, for example. So so I often talk about diet and even exercise in a way that's trying to minimize even more stress for the patient. So I think about that mostly.
Okay. Oh, sorry, go ahead.
No, go ahead, actually. I was losing my train of thought. So get me back on track.
Yeah, well, because what I was thinking about was, so I know for a lot of people, working out, physically training hard is so good for reducing your mental stress. But what came to mind was, though, that physically stressing your body and then not having enough rest. So, on one hand, you're reducing maybe mental stress, but then you're really stressing the physical body. There's a little fly flying around. Sorry. I don't know if you keep seeing that. It keeps going in front of my face here. And then, yeah. And then on, like trying to find a balance of working out and finding that stress release on that level. But then also maybe incorporating a little bit more of different types of exercise that are not so physically exhausting and fatiguing. What are your thoughts on that?
That's spot on. I mean, I oftentimes, like I mentioned, I don't like I'm not a personal trainer. So I'm not going to tell somebody that they have to work out a certain number of hours and certain number of days per week doing, the certain weightlifting routines or things like that. And so what I promote is just being mindful about your movements. And so instead of thinking you have to go exercise and lift weights to look a certain way, it's how about just getting in the right types of movement practices so that you're feeling healthy. Yeah, you can throw in the weightlifting on several, few of those days out of the week. But if you're not also incorporating some kind of yoga practice or just being outside and doing something that is, accessible, some hike that you can get in a day or on the weekends, and getting that exposure to sunlight, working out outside. So diversifying the way that you exercise is super important, as opposed to just feeling like you have to go to the same, gym, that same box every day and doing the same movements every day. That might even start to be taxing on certain joints or certain muscles that you're that you may be working out too much and causing inflammation there. You have to be able to diversify your exercise as well, because it's also less stressful for people to feel like they don't have to go and do that gym workout every day. It's like nice to have that kind of like a more diverse kind of like options for working out, and especially with things that we know helps with your mental health, with things like yoga, or getting into the restorative yoga, right? Because some of that stuff, even for people who are constantly on the go, feels like it's even just boring or just not doing a whole lot for you physically. But it is, because you're doing, there's movement involved, but and you're also being able to just relax the mind for that time that you're there, as opposed to like being, like you said, go at the gym when you're there.
Yeah, actually, in yoga, they talk about the three gunas, which is Raja, Sattva, and Tamas. And so when you are in Rajas, it's this energy. So all three energies, um, kind of permeate like life. And Rajas is this sort of like very overactive. And then Tamas is very like acidic, slow, sluggish. That would be like fatigue. But the point is to become like, sattva, or to become sattvic, which is like that middle way. So you're trying to balance both. So, okay, I've been go, 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 go. Now I know that I need to do something to rest and relax. And that involves the mind, because if your mind is constantly
Mhm.
thinking, which is a great segue into women, female stress,
Mhm.
hormones, because we've talked a lot about men, but that, busyness of mind, that is going to start stressing your system and causing a lot of imbalance. And I know for women, the overactive mind, especially, um, I'm curious as to how that will affect hormones and cortisol levels for women, and then like adrenal fatigue and like sex hormones and everything else.
So just being overly stressed for women,
Mm-hmm.
it goes back to the same thing. Your adrenals are going to be important for maintaining your hormonal health, your balance as well for your sex hormones. And I think I explained this to you earlier too, is that the glands in our body that make these hormones, that release these hormones, they each have their own specific job and what they're doing, but they also influence each other. They talk to each other. That's often described as like a symphony. Like the way that these glands and the hormones work is that if one of them is off, then the other ones are going to be off as well. And
Mm.
so you have to kind of, when you're approaching the hormone issue with women, men or women, you want to look at all of the different hormones so you want to look at the thyroid, you want to look at the adrenals and cortisol, and because when one of them is off, it can influence the other. And the other thing I mentioned with you too is that the symptoms of having low sex hormones or low cortisol or low thyroid, they start to look alike a lot of the times. So if you're
Mm.
thinking about just like fatigue is one of those symptoms that it can be a sex hormone issue, a testosterone issue. And it might also just be that you're actually low with thyroid, or it might actually be that you're just so adrenally you're fatigued that you're seeing that just low energy coming from that. So um, when you test hormone health for men or women, especially women, if you want to see what the progesterone is doing and the estrogen is doing and see what the testosterone is doing, you have to also include the proper cortisol testing to see what your cortisol curve is looking like, because that's going to also be important especially with how to treat that patient if you're going to give them some kind of hormone replacement therapy to get their levels back into balance. Then you might also have to address the cortisol if it's not where it's supposed to be as well. And there are certain tests that'll tell you all of this information at the same time. Because you need to approach it kind of like that, with all of those components being considered.
Yeah, because I tried to get off birth control a number of times because they had put me on it when I was pretty young. And it was, I think, to try to control PMS symptoms, which I now understand PMS symptoms and the severity of them can often be imbalances already in your hormones and in this sort of delicate ecosystem. So I had been on it for so many years. And then finally, when I came off, it was like, oh my goodness, my hormones just so up and down. And I'm kind of curious because I mean, that had taken quite a while for my hormones to balance out after. And I did this sort of detox with an Ayurvedic doctor when I was in India, and that helped to balance me out. So I was really, really lucky that I was able to experience that. But if your hormone levels, both in male and female, are low or too high, how does that affect libido?
So that's one of these like keynote symptoms of sex hormone imbalance. And so like again, I can speak to the for sure testosterone and with deficiency in men. So one of the main reasons why they would come in is because they've noticed a drastic drop in their energy and in their libido. Those are the top two things: low energy, low libido. And like I mentioned, yeah, they're not seeing the same results that they might have seen before at the gym with as much effort that they're putting in. But it's always going to be, if there's low libido, then there's not a whole lot of other explanation for it, other than maybe there's some psychological component too, or maybe there's just like a there have been changes to their relationship, their main relationship, that now there's less libido, and it's more like a psychological thing. But mostly it could come down to just these hormones being out of balance. And for testosterone, that's one of the main symptoms. For women too, women have testosterone as well, and they should have it at a certain range, and if it drops too low, then you're going to see really low libido as well. So it might be a low testosterone issue for women.
Okay. Excuse me. I was also going to ask, this might be kind of a funny question, but what hormones in women starts to make them grow chin hairs? Is that like, cause and this is really funny, but, when I had come off birth control, I tried to come off it the first time. I think that was in like 2015. All of a sudden I started growing like these persistent, like 2 or 3 little chin hairs. I was like, what the heck? So what causes that?
So that would likely be just a bump in testosterone levels that maybe you hadn't had before, because you're going to
Oh,
see acne and facial hair that maybe you hadn't seen before.
yeah. Acne for
So
sure. I would break out so bad.
yeah, so that
Mm,
might be explained by the maybe a bump in testosterone. And so if
interesting.
you think about some of these, if you've heard of PCOS or polycystic ovarian
Yeah.
syndrome,
Hmm.
that's one of the main symptoms that they'll notice. And that's an issue with testosterone being too high. It's an issue that actually goes back further a little bit to more just like a blood sugar issue as well for PCOS patients. That
Interesting.
the so yeah, so that's one of the symptoms, is that facial hair.
Interesting. What about for like older women though? Like when they start, because like I think that's one of the things, like for women when they start going through menopause, they like that's like they get a lot of, facial hair and things like that. Is that a bump in testosterone too?
For menopause,
Yeah.
yeah, it's hard to explain then.
Mm,
For menopause, so menopause is when you're getting a lot less production of your sex hormones, because the ovaries just don't produce what they stop producing what they were before. And so
mm,
um, you can check your levels at any time. You can check if you're curious as to what is happening, and if you think it's like a sex hormone issue, you
mhm.
can in menopause also check what your levels look like, and if there's any and if you're just and if you've got all the symptoms that come with menopause, and it's affecting quality of life, then there's a way to take hormone replacement therapy at that stage to correct a lot of these kind of drastic changes that you'll experience. And so if you check your levels, and if it shows that you can make a case for maybe taking some of these sex hormones or taking a little testosterone for libido, then that's totally fine as well.
Oh,
Uh,
interesting. I didn't
yeah,
know that women could take testosterone.
yeah, yep.
Okay. 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 Well, we kind of sidetracked a little bit there, but that was, I was just like, wait a minute. I'm thinking about
Curious.
my chin hairs. I must know the answer. Okay. So, I know we're not going to go into it super far, but just to briefly explain that concussions and brain injury can be connected and cause low testosterone. Just because that is something we briefly discussed. And
Mhm.
like I said, we don't have to go super far into it, but for people that are curious, Dr. Christian has a bit of an
Yeah.
answer.
So If you think about how testosterone is even made, we can start there. So I mentioned the HPA axis, and that's the hypothalamus, the pituitary, and the adrenal glands. That communication that happens between them, so that you can get the cortisol hormone that you need in efficient amounts that are necessary. You have that same kind of communication with testosterone. So you have the hypothalamus that communicates with the pituitary gland, that then communicates with the gonads to release to make testosterone. So what happens is, if you are having an injury, then hypothalamus sits in the brain. So if you have a concussion, there's an injury there, it can change the way that communication happens. So again, hypothalamus to the pituitary, then tells your gonads, which is your testicles, to produce testosterone. And so, does that make sense?
Yeah. I'm just curious, can the same thing happen in women who have had like trauma to the brain or injury?
It's the same communication chain. So
Okay.
hypothalamus to the pituitary to your gonads. So for women would be ovaries. So
Right.
potentially. So for men though, if there's an injury to the brain, again, if it knocks the hypothalamus, potentially it can affect the pituitary, could then affect the testosterone production.
Interesting. Okay. Yeah, no,
So
that does make sense.
So theoretically, it makes sense, though I'm not sure. I would have to go into like a research dive and see like how many cases that they have talked about where there is this they call hypogonadism that isn't coming from the testicles themselves. So if there's an issue like with the anatomically, with the testicles not giving you the testosterone that you need, that's called a primary hypogonadism. So if it's happening anywhere else, it might be like a secondary or tertiary issue that's causing hypogonadism. So if it's happening that high up in the brain, it wouldn't be the same as what other people would be experiencing with like that primary hypogonadism.
Sorry, and what is hypogonadism?
That's the low gonad. So it's a low testosterone production, basically. So there's
Okay.
it's the gonads should be giving you, the testicles should be giving you testosterone, and they're just not giving you what you need. So it's
Okay.
low testosterone in essence, low testosterone production.
And just curious for like maybe people who have one testicle or have had surgery or have experienced like, some kind of cancer in that region, does that then also affect how much testosterone they would produce?
Yep. So that would be a part of that primary hypogonadism. If there's like an undescended testicle and it's causing issues with your testosterone production, that would be a primary hypogonadism. Yeah.
Okay, interesting. All right. I know earlier you had mentioned vitamin D and IV therapy. So, for some of the things that people can do to help their healthy, happy hormones, what would be your recommendation?
So for men, I oftentimes see a low testosterone, or less than optimal testosterone levels. Are oftentimes, if I test the vitamin D with it, vitamin D is going to be low or close to it. And so vitamin D is one of those vitamins that are considered a hormone, even because they're so involved in the way, again, that symphony of how our glands and the hormones that each of those glands makes, like how they're all working together. The vitamin D is super important. So you need a healthy amount of vitamin D to produce testosterone and your other sex hormones as well, and keep them in balanced. So when I check somebody's testosterone levels, I'll check their vitamin D, and if they're low, on the vitamin D or close to it, then I know how to supplement it to get them to optimal levels, because it's going to help their testosterone production at the end, their natural testosterone production. Like I mentioned to you, especially with men, the goal isn't to keep somebody on testosterone forever, this TRT forever, especially if you're in your late 20s or early 30s. You want to do it so that you're able to kind of get your groove back, to get your energy back and your libido, and maybe start to see some changes at the gym and getting motivated, have that motivation again. But you don't want to have to be on it for longer than you need to, especially if you're that young. If you test for things like vitamin D and you see that you're low and you fix that vitamin D deficiency, it's going to help your testosterone production. If you're eating the right foods and if you're working out, if you're incorporating a lot of mindful movement into your life, if you are going outside and doing, again, getting that out, working out outside and all the benefits that come from that. If you're doing the right supplementation. So if you're, if somebody is taking there's certain things that you can do for your adrenal health to make sure that your adrenals are functioning optimally. Taking certain adaptogens. A big one for men is ashwagandha. That's a really good one that I would recommend for men, just to get some of that adrenal health back in line. If you're doing, just thinking about the way that we're sleeping and caffeine and stress from work and stress management, if you do all of these things, and again, you're on top of things like vitamin D, whereas maybe you didn't know that you were deficient, then you're gonna, and if you ever decide to stop being on testosterone therapy, you're going to be in a better place than you were before. And so while you did use that testosterone replacement therapy to get you back on track, it's not something that you need to be on forever, especially if you've made some of these these corrections, like with vitamin D, and with your adrenal health.
Yeah, actually, I take ashwagandha and bacopa, and I found that has made a huge difference in my stress levels. And that was actually recommended to me from a friend. She's an Ayurvedic practitioner, and it's just something simple you can take. And I've also I'll take like a week off so my body doesn't get too used to it. And I always notice that the week that I take off is like I'm way more stressed.
Without the ashwagandha?
Yeah.
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 So that's they're adaptogens, and so they typically require that you dose them a couple times per day and in high amounts. So instead of taking a supplement, maybe you take one capsule a day or at night. With these plant medicines, with adaptogens like ashwagandha, it's likely 2 capsules in the morning, maybe another two early evening, and then you're doing this every day, and you have to do it for a long period of time for you to get the full benefits. And the full benefits of using an adaptogen is that you're helping to restore the adrenal glands. So they do. Sometimes some of them you can see the effects after a few, maybe a week of taking it, and you're just like, wow, yeah, I am functioning better. That's part of that is your adrenal glands are starting to recover. But you want to be on these adaptogens for, give it a shot, 3 months, see how you feel. With things like ashwagandha. Maca is another really important one for men and women, but I've seen it be really effective for men. And again, maca is an adaptogen, and there's, with a lot of these plant medicines or supplements, there's good quality and bad quality, or things that maybe are likely to help and other forms of it that maybe are more helpful. But if you get a good maca supplement, can be really helpful for men, again, to reset the adrenals, support the adrenals, but also can be immediately helpful for things like libido or energy, like that. I've seen that be really helpful for patients as well. So I would say for men, the 2 things you want to think about for to restore the adrenals are the adaptogens, like the ashwagandha or like maca. But also thinking about the right supplementation that will give you the nutrients that you need for better adrenal health and better testosterone production. We talked about vitamin D. Again, testing for that is super important so that you know exactly how much to take to get you to the optimal levels. But then there are other nutrients that you're going to benefit from too for the adrenals and for your hormone health. And I like the B vitamins for that. So B5 is really helpful for the adrenals, as well as and B6. And B6 is really helpful for balancing the sex hormones in women. So those are two really good ones. B12 is helpful for so many different things, but you would want that for more energy typically. But B12 is amazing. It nourishes your blood health and nourishes your nervous system. So you might see improvements to if someone leans towards anemia or having low energy from anemia. B12 could be really helpful. As well as so if somebody's just feeling like just issues, like maybe more numbness and tingling in the hands and the feet, and B12 is going to be really helpful for that as well. But so I guess going back to the adrenals and going back to testosterone again, you want to think of some of these nutrients. And if you're not already doing a lot of these things and you're seeing low testosterone, then you've got a lot of options, right, to get you back to optimal levels more naturally without that TRT intervention.
So, actually, it's so funny. We're talking about memories from that festival and it being so good. I totally forgot, but I recall going and getting a vitamin injection when we were there. And I remember feeling like so good after. It wasn't an IV, it was just like an injection. But I know that certain vitamins, especially like B vitamins, I find the few times I've had injections, I actually feel better. Whereas I often find when I take like the pill form supplement that I almost feel like I'm just kind of peeing it out. Is there a benefit of like injections and IV drip over, supplementing and taking pill form?
Yes. Anytime you supplement something, and it needs to go through your GI tract, so it needs to pass through your stomach and then down to your small intestine. So if we're just talking about B12, for example, the reason why you felt so great was because when they injected it, it went into the muscle, so it's a faster route of absorption into your bloodstream. And so if you wanted an even faster route of absorption is if you do an IV drip. So that's going to go directly into the vein. So when you're connected to one of those IV drips, it's through the vein, usually in the arm. And then that goes, it's already, as it's going in, mixed in with your bloodstream. So it's already there. You're going to benefit from it right away. And so when you take something orally, especially something like B12, you're likely taking it because your levels are low. And the reason, the major reason why it would be low in the first place is because you don't have good absorption through the gut to begin with. So this malabsorption is likely causing you to feel the symptoms that you're feeling. So if you're trying to fix that by putting more things through that same kind of absorption process, then you're not going to bump your levels up high enough, fast enough, so that you're getting a whole lot of benefit in the immediate sense, right? So if you take something like B12, it has to go into the stomach and attach to something called intrinsic factor so that it can then travel to the small intestine where it's absorbed. And so if you take something that's supposed to be like, let's say 5 milligrams of B12 and it gets down to the small intestine, it's a lot less of that gets there and that you're actually able to absorb. Whereas you can do a 5 milligram injection into the muscle and you're going to get most of that.
Okay. Yeah. Interesting. I know, because if you think about it, like you pay quite a lot for supplements. Like they're not generally, like high quality supplements are generally not that cheap. But at this rate, I'm kind of thinking like it'd probably make more sense to just go and get an IV drip, because you're basically just like, peeing it out and having very expensive pee.
Well, and then sometimes too, if you do an injection and maybe because B12, for example, is water soluble. So if your body's able to use what it will use in that moment, and if it's too much, you might notice that your pee gets just a little bit pink. It's like there's a slight change in the color. And that's because maybe the injection was a little bit too much. But again, you can't really overdose on things like B12. Certain vitamins you can. With B12, and you can't really. So if you take a dose that's too high as an injection and you notice your pee changed a little bit, that's totally fine. But yeah, so the idea here is if you're taking supplements, it's because you're thinking about potentially being not having enough. But why aren't you having enough? Why are you potentially low or deficient on some of these nutrients to begin with? So again, always comes back to making sure that your diet is healthy and you're trying to get as much through just like that kind of through proper nutrition. And then if you're realizing that your diet is great, but maybe you're still not getting where you need to be, or you're still feeling symptoms of certain vitamin deficiencies, or maybe you even go as far as testing, and you see that a lot of your levels are low, then you have to think about a malabsorption issue. Like, why aren't you absorbing these nutrients that you know that you're getting in your diet because you're on it, but then you're still feeling symptoms and it's still showing up as maybe low? Then you'd want to make sure that you're not continuing to just put stuff down through your GI tract that aren't going to be absorbed the way that they should be. So but we don't go through that effort, right, of doing those testing to test to see if a lot of what you're feeling is coming through from a vitamin or nutrient deficiency. So the best we can do for a lot of people is just to do a multi, because it's easier, and maybe you can take one a day or however many, and then hope for the best and hope that it's doing something and hope that you benefit from it. But if you wanted to just go with what we know is the best for absorption, the best route for taking these vitamins, why not just go to an IV if it's accessible, or even an injection of these vitamins, which you can do. Some people do it weekly or every other week, or even once a month, just to get that boost in B12, for example. The IV drip wouldn't, you could put more things into an IV bag. You can put in vitamin C, magnesium, the B vitamins, zinc, selenium, things like biotin and lysine and taurine, which are all amino acids. You can put all of that into an IV bag and then have that go directly into your blood, into your vein, to your blood, and benefit from that in the immediate sense, which people really love to do. So if someone's feeling super depleted, maybe they went out on vacation and came back super depleted, maybe they just had a really busy week at work and they're just feeling just worn out, or maybe someone's feeling under the weather, they're feeling like they're getting sick, or just trying to get over a recent sickness, then illness, then they can do an IV bag and get all those nutrients real time and benefit from all of that right away, as opposed to doing, maybe increasing your certain supplements orally on those days that you're feeling out, not feeling great.
See, I wonder if that would, as we're talking about this, I wonder if that would be good for me, because like I definitely have like digestive issues for sure. And like my diet is so restricted right now because of my digestive issues. I just went and saw my naturopath and he tested my allergies and we looked at my blood, and yes, I am very restricted on what I can eat and digest. So I wonder if maybe something like that would be good for me, because basically since my last car accident, I'm so fatigued and so tired all the time. And I feel like I've often wondered, like, well, maybe because now I have some digestive issues, if that's affecting my body's ability to like recover and repair. So for somebody like myself who has, suffered like a physical trauma to the body and an injury, would an IV maybe, and then digestive issues, would an IV maybe be a better option for me than taking like pill form?
Yeah. So if you are having a lot of these digestive issues, then very good chance that you're also having a malabsorption issue as well. So this is why doing things as vitamin therapies as an injection, or doing it as an IV, this is why you respond so well to it, right? Like if you have you had one recently?
No, I haven't. I'm trying to think. I think I might have had, I may have had an IV vitamin drip once, but I've had a few injections like into the muscle, but it's been I don't know, quite a while.
Yeah. So then it'd be good for you to try one out and see how you feel, because if you're having all those GI issues and maybe you're restricting maybe too much and maybe not getting some of the nutrients that you need in, then doing it as an injection or an IV is just a faster route of absorption, and you're likely to feel just the benefits of those things just a little bit more. Yeah, faster. So yeah, I can see that you would benefit from a B12 shot now mixed with some other B vitamins and other helpful nutrients that you can mix into an injection and just do it as an injection as well. Yeah.
I wish I lived in West Hollywood. Then I could come see you. But also just because I feel like it just seems like a much more fun and lively place to live in general.
Right now.
Sorry?
So right now, is it pretty closed down over there still?
Yeah, we're pretty restricted. Things are starting to open up a little bit, but I don't know. I just feel like Canada in general is so restricted. And every time I go to the States, it's like, it's still like, for me, I feel like it's kind of like the wild, wild west. Like there's just more things to do. It's more diverse, and it's more of a fun and lively atmosphere, where I feel like up here, maybe I've just lived here for too long and I'm like ready to move on. But anywho, so what I was going to say is, if we could leave people with a takeaway, foods to focus on, sleep, and then a few sort of like, say somebody can't afford to go see a naturopath and have their levels tested, what are a few things that they can take and an approach that they would be able to at least start with for now?
So the easiest thing that we can do, and it's easier said than done, is to just take care of our adrenal health a lot more than we're likely already doing. So I think that we just get caught up on living this really fast-paced life, most of us, and we think that it's just normal to be this stressed out and to be this overworked, and then we don't get enough hours of sleep in at night, and we just function the next day, and we don't think about making the right changes that we need to make for better sleep hygiene, so that we're getting enough sleep in, that's restful sleep. And then if that's just, if you're thinking about your day from beginning to end, there are so many things that we can do to just improve our health outcomes from the beginning to the end of the day. And so when you wake up, are you doing something to just get your body moving? Are you eating the right foods for breakfast that give you enough protein so that you're sustaining your energy throughout the day and you're not seeing that dip in the middle of the day? Are you doing anything else to manage stress outside of work? So that stress management is super important. We tell people to meditate, and are they really doing it? But it's so important to meditate. Take some time and just like and I always say, do it outside. Get the double benefits of meditation, but also of being outside, of grounding, of getting some sun, doing all of these. It's all lifestyle changes that need to happen. But it requires us to kind of step out of that everyday kind of go mentality that we have, and start from the beginning and think, what can I do differently in the morning, in the middle of the day, at night, so that I am taking care of myself and taking care of my adrenal health, because people don't even know oftentimes what the adrenals are, where they sit, and what they do. So like just giving the people in that kind of information from that angle of letting them know what the adrenal glands are, what cortisol, that stress hormone does, and why we need it. I think we talked about that here as well, of how we need that cortisol to be at the right amounts throughout the day, right? We need it to be high in the morning to get us up and awake and alert, and we need it to come down at a nice curve so that at night we're able to wind down and go to bed. And so if we don't have that happening, if our adrenals are out of whack because of our go lifestyle, and because we're not taking we're not doing the right things to just kind of stay stress free throughout the day, and to to keep our adrenals healthy, then that cortisol is just going to be wonky. Now you're going to be tired when you should be awake, and awake when you should be tired, and nothing makes sense. And then eventually, like I said, that because the adrenals are so taxed, that cortisol is just going to start being low, just chronically low. And so now that you've got that chronically low cortisol, you're going to be affecting all of your hormones. And so, like I mentioned, testosterone's that one, because I see mostly men in my practice and I see them with low testosterone. They fit that prototype to a T. Like they're that person who's overstressed and not thinking about ways to de-stress or self-care, and being mindful about the things throughout the day, like every step of the day, morning, middle of the day, nighttime, like what could you be doing differently just to have a little bit, be more mindful about your adrenal health, and that's going to make a big difference, and I think that translates to women as well, is like, what can we be doing to take better care of our adrenal health so that all the other hormones fall in line, so that we're not seeing testosterone plummet in our early 30s. So like you said, it is sleep, but it also is eating, healthy, mindfully, working out mindfully, doing other things mindfully, meditating, and doing things that can help, like supplements that we know are helpful, the adaptogens that we mentioned, the right supplementation, doing some things that maybe you wouldn't have thought to do before, like an injection or an IV drip, just to give you that good quick absorption of some of these B vitamins, especially. All of these things, right, without even testing. Of course, there are some costs involved with those vitamin therapies, but without testing for anything, you can, just knowing what the adrenal glands do and what cortisol does, we should be thinking about our days in a way that are centering how we think about our adrenal health, basically.
And as you were saying this, I thought of two more things. I wanted to ask you about caffeine intake and when would be a good time of day to consume it. If you do, how much? And then when you should kind of, okay, like for me, if I have caffeine past 3, 4 at the latest, I'm not going to be able to sleep at night. So I wanted to ask you that before we part, but I also wanted to ask you about melatonin and taking melatonin, and if that would be something you would recommend for a short period of time and how much. Because I think a lot of people think you're supposed to just take melatonin just to make you get tired. But my understanding is you're supposed to take it at the same time every night consistently.
Yeah. So, and what was the first part of that?
The first part was about caffeine.
Oh, right. So caffeine. So I drink caffeine. I'm not gonna lie. I love coffee. Yeah, you're still doing it. I don't know what time it is over there, but it's 3 p.m. here.
It's 3.
So the most important thing with coffee is I think people like to get up and drink it first thing in the morning because that helps them get up and wake up. But you definitely don't want to do it on an empty stomach. That's the only thing that I see oftentimes people doing, is that the first thing that goes into that stomach is coffee. But it can be really irritating and kind of taxing on the stomach for sure. So you want to make sure you're having it with some other breakfast food, and then have the coffee, and then try and stick to 1 or 2 cups a day, because I definitely have seen patients that do way more than that. And then drinking it through like the middle of the day is probably not a good idea either, because that's just too much stimulation and it's going to affect the way that you're able to fall asleep at night. And this is all obvious, right? I think for people know that, like, caffeine's going to keep you up. Though for some people it has an opposite effect at night, which I've seen before too. They drink a little bit and then it causes them helps them just feel tired again. And that's just like next level. I think it's officially starting to do something else to the body, but general rule of thumb is to keep it in that first half of the day and try not to have any on an empty stomach. So the issue about melatonin is I'm not against using melatonin as a supplement to help with sleep, but it should be done in the short, like just a short term for a short period of time. And so when you look at the supplements that are out there for melatonin, you can find it as mostly as a 3 milligram dose. And so when someone goes and they buy melatonin, they'll take a capsule and it's 3 milligrams. I've seen it as a 1 milligram, and I've seen it as like even higher, 10 milligrams, because there are certain reasons why you might want to take melatonin as 10 milligram or 20 milligram dosages, because they see that it works for things like cancer, for example. But there'd be like a naturopathic oncologist or somebody on that's telling you to take that amount. You shouldn't ever need that amount just for sleep. You don't really need that much. Even the 3 milligram is a lot for sleep. And so, but it's useful for people who are maybe jet lagged or in the short term need to be able to get their sleep back on track. But your body only needs 0.3 milligrams. That's like the physiological dose that your body needs to be able to sleep. It's just 0.3 milligrams. And so when you're taking 3 milligrams every night, that's a lot, right? That's like at least tenfold. So, so that's why anything that's 3 milligrams, you use it in the short term. Try not to get used to it, because you should be able to do that 0.3 milligrams. And I know of a supplement that's available that's actually the 0.3 milligrams. So if you're having just bad sleep and it's a chronic bad sleep, then you might just need to take that 0.3 milligrams every day for a longer period of time versus that 3 milligram that's widely available that people will most likely be buying at the store. That makes sense?
Yeah, it does. Well, because I have a 1 milligram tablet, and I won't take it all the time. But for an example, my sleep can sometimes, like if I get a really bad flare up of pain, I won't sleep. And then I need to sleep in a little longer or a little later that day. That's just how it goes sometimes. And that's all it takes to throw off my schedule. And so sometimes I'll need to take for like usually about a week, I'll set an alarm that tells me to take it. And I'll just take the 1 milligram at the same time every single night for about a week. And then I find that I can start waking up at the same time and I'm waking up alert.
So that's good. 1 milligram is still good. Like I said, 0.3 milligrams is physiological dose. So if you're doing 1 milligram to help you sleep, that's good that you don't have to bump up to the 3 or the 5 or anything higher than that. But you're using it appropriately in that you're only using it for that 1 week just to get you back on track, and then you're good to go without it. But yeah, I'm a fan of even the 3 milligram, because sometimes you just need to conk out and there's nothing else that's going to do it. So I mean, natural, right? That's going to help you do that. So
totally. Yeah. Well, this has been such a nice conversation. There's so much here, and
I know. I feel like I want to keep going and just kind of
we can. If you've got a few more points you want to get to, absolutely. Go right ahead.
To clarify, I feel like a lot of what I said was kind of like all over the place. I think when we talked about it before, it came out better.
No. There's a lot of information there. And I feel like it was good to circle back to a lot of the topics here, because I think that there's just so many different things that are influencing and affecting our hormones and like that overall health. So I feel like we've covered a lot of ground. But I mean, if you have some more stuff you wanted to touch on, because I know we were kind of talking earlier about touching on trauma and PTSD and what happens to the hormones after the fact. But I was thinking that was also perhaps really similar to like the, concussion and the brain injury and the connection to your hormones. Or
yeah, I mean, it's all the idea with that, with when there's trauma, is that the over time, if that trauma goes unresolved, then it does affect your adrenal health and how you respond to stress, because your body's constantly in this fight or flight. When there's trauma, when you're on edge, right, then your body's constantly going into this rush of these of the neurotransmitters that get you to that response. So when you've experienced trauma and this trauma goes unresolved for a long time and you haven't really worked through it, then your response to stress is going to have, it would have been affected, because now your adrenals are functioning in a way where they're not giving you enough cortisol coming from that chronic stress. And so now you've got chronically low cortisol. So a lot of the same things that we talked about will apply. It can affect your hormone balancing in other areas. And so with trauma, the when you're in that, one of the things that happens too when you're dealing with PTSD is that you're going to see a lot of GI symptoms as well, because if your body's constantly in this fight or flight, like constantly feeling like it's under a lot of stress, and you respond to stress in a way that's not normal because your cortisol curve is off, then you're going to feel that you're mostly in that fight or flight. You're going to be mostly in that the sympathetic nervous system, as opposed to your parasympathetic nervous system, which is more of like that rest and digest. When you're not stressed out, then your body's able to function appropriately. You're able to digest, for example. That's more related to your GI health. And so if you're not able to be in that rest and digest part most of the time because of that PTSD, and you're constantly in this stress mode, then it's going to have an effect on your GI health. So that's another thing that stands out. But I wanted to maybe end with just talking about, I guess, because I do men's health and testosterone, the main message that I wanted to kind of to give was that testosterone should be thought of, especially as testosterone replacement therapy, as something that's more normalized. There's no stigma around it, because I think that when you talk about patients or if somebody who is taking testosterone replacement therapy now, they almost are afraid to talk about it because they don't want to be seen a certain way or judged for it. But it's totally something that you can do to, like I said, for better quality of life, for better health outcomes. And as long as you're seeing it as like a fix for something that you don't have to do forever, just for the, and to get you back to having good energy levels and better libido and better results from the work that you're putting in, the efforts that you're putting in at the gym or anything like that, then it's something that at the end too, for people who have chronic or really low testosterone levels, who are in their later stages of life, the 40s and 50s, there's better health outcomes for your heart health and for your blood sugar health. So there are more benefits to doing testosterone replacement therapy than letting it go untreated if it's low or deficient. So that's something important to think about, because I think that if we can do one thing, is to demystify that testosterone is this, replacement therapy or testosterone injections are scary, or something that isn't an option for people. It totally is, as long as you're doing it in a way that's supervised and you're getting your levels checked and you're doing frequent follow-ups to make sure that you're not causing any issues like estrogen levels being too high or testosterone levels being way too high. Other side effects could include maybe some testicular atrophy, and that's when the testicles start to get smaller in size. That can be caused by, again, this doing it in a way that's not supervised and your levels are going out of whack. So it's important for men to know that there's an appropriate way to fix these levels and to get the benefits of testosterone. And then there are other ways that maybe are good for you, because that's the journey that you're on, and maybe not doing it for too long without having the appropriate labs done so that you know what it's doing to your body. So that's why with TRT, it's important to also think about HCG and know how that works and what that's doing for your body, and making sure that you're blocking estrogen or blocking the conversion to estrogen in a way that that's appropriate, so you're not dealing with now really high estrogen levels that can leave you in a pretty bad situation as well. We talked about, you mentioned like the gynecomastia, the boobs on a guy that might be explained by somebody testosterone done in a way that's not appropriate.
Or anger and rage.
Right. So,
That's often been associated. That I think is a big one. The negative connotation towards any kind of like testosterone injections.
yeah, and that's the estrogen climbing. So that's how you know too, if somebody is doing something that's not TRT, there's going to be less control for estrogen rising. And so that's why it's, again, there's this stigma around people who do testosterone therapy or, you know, some of the synthetic stuff, and that there's this like roid
rage,
or
yeah.
just like there's mood swings. And that's because estrogen's climbing and they're not doing anything to control for it. So proper testosterone replacement therapy is going to involve regular checks that will include checking your estrogen levels. And then also knowing if somebody's more I can check when I do my basic labs on somebody who wants to be a patient. I'll see their testosterone, I'll see their free testosterone, I'll see their estrogen levels, and I'll know if they're already converting a good amount of their testosterone to estrogen efficiently. And if they are already efficient converters, then I will know to start them on a dose, an appropriate dose to keep their estrogen in check. And so again, if you don't do these basic labs to begin with, or if you don't do these a full testosterone panel to begin with, then you don't know baseline, then you're kind of just doing a shot in the dark kind of thing, right? And you might, when you decide to finally check your levels, be in a situation where it's going to be a little bit harder to come out of. And so, for example, patients who didn't think about fertility right away, who maybe went into doing testosterone, went to doing the synthetics, and they loved it because they feel great. Obviously, they're going to feel like beasts on the testosterone at really high dosages, or the synthetics, they're going to feel like their bodies are just, you know, where they want them to be. But then life happens and they want to all of a sudden think about fertility, and then they come to get their levels checked, and their FSH and LH, which are two hormones that are released from the pituitary gland as well, are you can't even, they're too low to even measure. They're way too low. So then that's a direct kind of sign that their fertility has been affected.
So it can cause your ability to then have babies, basically.
Right. If you're not careful, if you're not doing some of these things that we do with TRT to kind of control for that. So your LH is your luteinizing hormone, and that gets released from the pituitary, and it tells the cells in your testicles that make testosterone to make testosterone. So that's how you get your testosterone production. And then there's the FSH that tells your testicles to produce sperm. So both of those numbers will come down if all you're doing is pumping a bunch of testosterone into your body. Then your body is going to the communication that tells your again, that HPG axis, the hypothalamus tells the pituitary glands, that tells your gonads to do what they're supposed to do. When there's a lot of testosterone floating around, then your body gets the brain gets that signal that there's enough floating around, so we don't have to make our own anymore. So it starts to shut down that production, that line of communication. You get less of that luteinizing hormone, and you get less of that FSH, the follicular stimulating hormone. So because that extra testosterone is there and circulating, you're shutting down that communication, and now your body's making less testosterone on its own. Now your body's making less sperm. Your testicles are producing less sperm. So you can see now how this ends up being a bad situation for men down the line, because they're doing testosterone and the synthetics and whatever else they're taking, and it's unchecked, unsupervised. Now they've hurt their own fertility. They've hurt their own testosterone production. Then because the testicles are 80% the volume of the testicle sperm from sperm production, if you don't have that happening anymore, then you're going to see testicular shrinkage, the testicular atrophy. So if you're doing a lot of this unsupervised, then it's just a recipe for disaster a lot of the times. it's good in the short term because they're likely feeling, like I said, they're feeling like beasts, and they feel like they're noticing the physical changes pretty quickly. So, and they'll want to keep doing it. Some people will do it for years, like you said, like somebody could be on it for 10 years, and then finally come around to checking their levels. And it's not that it's too late, but there's going to be quite a bit of an uphill climb to get it to a place where you're doing it appropriately, and you're being supervised, and your levels are optimal, and you're not overdoing it.
Right. And, actually, that's a great place to, end things is like often we don't think about our future self. We don't think about our, self in 10 years and 20 years. And, it's especially when we're young, it's all about being in the now, and you don't think about some of the consequences or ramifications of what you do now and how that's going to influence you at another stage in life. I often think about that with taking care of physical health. That was one of the reasons that I did I started going to the gym and kind of being a little bit more active and building some muscle as a woman, because I was thinking, for bone density reasons, I don't want to be, 60 and 70 years old and have cracker bones or like have really weak lungs, like thinking about your future self. So in the same way, I would say, and I'm being funny about it, but juice responsibly. Just kidding. Go and get tested and think about, where you're, if you want to have that potential of, having a mate, having children, things like that. This is all going to be something that you need to think about, and your future self will thank you for.
Yep,
So,
exactly. And then always, again, I like to harp on this, is there's the HPG axis, and making sure that that testosterone production's where it needs to be. And then there's the HPA axis. There's the adrenals. You need to be more mindful about the things that we're doing every day, so that we have good adrenal health and good cortisol release that's efficient, and again, high when we want it to be high, and low when we need the cortisol to be low, and not just all over the place, because then we can't function when it's all over the place. When cortisol is all over the place or chronically low, then your other hormones are going to suffer from it. And I see that happening all the time with my testosterone patients. There's always an adrenal component, and so start there. It doesn't cost a whole lot, right? Just to try to make these changes every day to care for our adrenals a little bit more. Yeah.
So where can people find you?
So I'm mostly on Instagram right now. So it's at dr.christian.nd, and that's pretty much. There's, I think, the same on Twitter, Dr. Christian ND with no dots.
Okay.
And then that's it. I post things, again, I'll post things about men's health and TRT, chronic disease prevention and management, gut health, a lot of these IV and vitamin injectable therapies that we talked about. And then and the same on Twitter, just this is what vitamin D is good for, and try to give little bits of information like that as much as I can. But I'm out here in West Hollywood and Santa Monica as well. So that's where they'll find me.
Perfect. Well, thank you so much.